Hello and welcome to today's conversation where we'll be talking about matters pregnancy and the challenges that could arise during the pregnancy period. We'll be looking at the range of things that could possibly result in the pregnancy not turning out in the way that the pregnant mother expects. Now, we do realize that for most people, when they come to the knowledge that they are pregnant, they're usually very happy and excited, and they look forward to the pregnancy going to full term and to getting the baby and to becoming a parent of that baby. And on the most part, it does happen like that. But on some occasions, and for a good number of people, that outcome does not come through. And we'll be looking at what are some of the reasons that could result in a pregnancy not, developing in the way that was anticipated by the expectant mother. So the things we're going to talk about today are called teratogens.
What is a teratogen?
Teratogens are substances that have the effect of interfering with the normal development of the fetus and which would eventually result in, congenital deformities, that is, changes in the fetus within the uterus, so that by the time the child is being born, they already are having significant challenges in, their form.
What are the possible effects of teratogens?
They're actually quite serious, and which is the reason why we are taking time to talk about them. One, teratogens could result in premature labor. Usually you want to carry the pregnancy to term because that is what gives the developing fetus sufficient time to develop fully, so that by the time they are born, they are ready for the world. So when one is exposed to teratogens, the risk of premature labor is elevated. Another risk that one faces with exposure to teratogens is, premature delivery. So you get into labor and you end up delivering the pregnancy before term. So you get into a preterm delivery situation, which then means that the child is denied an opportunity to fully form within the environment that is the uterus. There's also the risk of the child dying in utero and the mother having a stillbirth, So all these things are very traumatic to the expectant mother, and to the extent that one can avoid, one would want to avoid them. And of course, the bigger one is that there will be significant deformities in the child arising from the exposure, depending on what the teratogen is.
Okay. And how does one get exposed to teratogens?
Teratogens are largely things within the environment of the expectant mother, and so it is possible that they can get access to them orally by ingesting them. It is possible that they can get in contact with them through the skin, so skin contact, and also through other openings of the body. That's a possibility. It's possible that one can absorb them over the air, as in the case of infection, so it's a whole range of possibilities of how one can get exposure to the said teratogens. So it's the environment around the expectant woman that basically exposes them to the risk of the said teratogens.
Do teratogens have the same effects in all instances?
No. So the effect of the different teratogens is a function of a range of things. So one is a function of when in the pregnancy is the pregnant mother exposed to the teratogen. if they are exposed early, then the risks are higher for that expectant woman, because it then means, say they're exposed in the first trimester, when a lot of developmental things are happening to the fetus. It means that all those processes are at risk of being interfered with. So the timing of the pregnancy is a function of the intensity of the outcome. It is also a function of how much of the substance or the elements is the pregnant mother exposed to. The more of the item they're exposed to, the higher the risk that may result. It's also a function of there's a genetic factor, right, that speaks to the effect of the said teratogen. So if there are certain pre-existing genetic situations of the mother, then how they process the teratogen would be a thing that impacts how the teratogen affects them. The other thing is, what is the nature of the teratogen? Some are more potent than others. So, for example, if the pregnant woman is exposed to X-rays or radioactive elements, the effects of that would be more intense than, say, if they're exposed to some mild infection, right? So the nature of the chemical or the element is also a thing. If they're exposed to temperatures that are, say, beyond 40 degrees relative to one who's exposed to temperatures of, say, 35 degrees. So there is a difference in how the teratogens would affect the individual.
What are some examples of teratogens?
Okay. So there's several, if I try to cluster them. So there's a category of drugs, and drugs could be those that are prescribed, those that are not prescribed, and those that are like recreational drugs. So examples of those that are not prescribed, like over-the-counter drugs, include common medication like Panadol, right? It is common that when we have aches and pains, we ordinarily just go and get a painkiller and use it. Now, when one is expectant, it becomes risky to just take medicine and pop it because you're used to doing it, right? Then you'd have prescription medication. So some people may be living with certain chronic conditions which require them to take medicine on the regular. Now, some of those medications have the potential to affect the developing fetus, and therefore it would be important for the expectant mother to be aware. The recreational ones are similarly problematic. Consuming alcohol during pregnancy, consuming a bang during pregnancy, consuming heroin, cocaine, and other recreational drugs, they have the potential to affect, the condition of the unborn child and even beyond the period of pregnancy.
Okay. How do teratogens affect the fetus?
They have different ways in which they could affect the fetus. So some could result in physiological deformities. For example, if somebody is exposed to deficiency of folic acid, it has been related to challenges with the spinal cord development, a common condition called spina bifida, where the child is born with the spinal cord exposed. So the deficiency of that particular element would result in a deformity such as that. Some of the other possible effects would be facial feature deformities. So you may find that the child has eyes that are either, looking they stand out. Let's just say the eyes are shaped differently as a result of the exposure to the same chemical. For some, depending on the timing of the exposure and the intensity, you may find that the brain does not develop sufficiently, so they have a brain that is perhaps smaller in a sense, and not just smaller as in they are a small-sized child, but smaller in the sense of the chemical exposure has resulted in the brain not developing to its full capacity, right? They have the effect of, because they interfere with the brain formation, they have the effect potentially of the child growing up to have less than optimal intellectual abilities. Children have been born with deformed limbs or missing limbs. Some of them affect the heart of the child, so therefore they form with heart defects. So there's a whole range of possible things that could happen when one is exposed to the teratogens.
Thank you very much.
So if you have any question related to this particular topic, feel free to reach us either on our phone number 0745 Nawiri, that is 0745 629 474, or write to us on email nawiriwellness@gmail.com. We'll be happy to hear from you.